Well, for more on the response to COVID-19 in Africa, I'm joined via Skype live by Pauline Muchina. She's the Public Education and Advocacy Coordinator for the Africa region at the American Friends Service Committee. Thank you for joining me.
Thank you for having me.
So, given what we've seen so far, how concerned should we be about the African continent and its various economies amid COVID-19?
Thank you. COVID hit Africa late. The other countries, Asia and Europe and America, got it before we did. But when it hit, it came full force. And we have to be really concerned because the situation there is conducive for fast spread of COVID. Health systems that are weak, people who are poor and cannot afford to social distance, governments that cannot provide food or basic services to people when they have to observe stay-at-home orders. And so it is very, very concerning, especially when you look at a country like South Africa, where, there is better services, they are a little bit better in terms of their health system, and infrastructure is better than most of the other African countries, and they are feeling overwhelmed already.
Right.
So we need to be concerned.
So then, which countries are managing the best and the worst, and what's really setting them apart?
So I think you have to look at the issue of leadership. Where there is good leadership, there is transparency, there is no denial of the existence of COVID, and governments are working with communities and are working with the private sector, and they are trying to find ways to stop this pandemic. And you find also that those are the governments that are working with other countries. They are not isolating themselves. And they are also not, their political power is not, does not depend on COVID. It depends on democracy. So like South Africa, they have very high cases, but it is because they are testing better. And because they are, also have a strong health system and they are transparent, they are not hiding their cases. So, a country like Ghana, that is using technology like drones, they are very successful. You look at Rwanda also, they implemented the restrictions very earlier on in the program, and also Uganda and Senegal. And you also find that countries that are using local technology and also producing PPEs locally have a better chance of survival, and they are doing very well. So leadership in each of those countries is critical.
Now, I want to talk about Tanzania because they're not publishing data. We're also seeing other countries struggling with bottlenecks when it comes to getting test results quickly at a speed that would make contact tracing and other technology the most effective. Talk about the importance of tracking the pandemic through data in fighting it.
It is extremely important because if you don't know who is infected, then they show up at the hospital the last minute when they are dying. But if you test people and find out that they need help in advance, then you get them treated. If you also have the ability to contact tracing through the data, you will be able to follow up, and those people who have been in contact with the person infected would also be tested and get the help they need before it's too late. Without that, then you're working in the dark, and working in the dark with this pandemic is not going to be helpful. We also will not be able to do things like effective treatment, a vaccine if it becomes available.
Right.
Without data, we won't be able to do much.
So then, having managed other viral outbreaks like Ebola, could Africa perhaps be more prepared than we might think to deal with the coronavirus pandemic?
I think so, because there are systems that were put in place, especially in West African countries, that are becoming reliable at this time. Especially health community workers that were established during Ebola, are helping with the community education that is needed right now with COVID. Also, the preparedness of pandemics or, epidemic like the Ebola definitely helped the health systems in those particular countries to be prepared. And also working with other countries and with the World Health Organization and also CDC Africa helped those organizations to develop the systems that have helped them to stop Ebola, although there are, occasional outbreaks in some parts of West Africa.
Right.
But that experience has been very helpful to those countries that have experienced it.